think there's a big focus on implementation right now because the guidelines that used to be pretty unique to New York were the New York AIDS Institute, and that's why it was so wonderful to present at the New York AIDS Institute because we have this history of advocacy and really trying to push this forward for a lot longer. But recently, the CDC and NIH, so part of the HIV guidelines in general, is now recommending intervention. So recommending screening for anal dysplasia and treating to reduce the risk of anal cancer for all people living with HIV. So that guideline is focused on just people living with HIV, and it's specifically anyone over the age of 35 who is men who have sex with men, and also trans women, and then all other HIV positive patients over the age of 45. So that includes, straight cis women and straight cis men, and the entire gender spectrum. Yeah, and then the New York AIDS Institute actually includes trans men who have sex with men as well for the 35 plus group for people living with HIV. And then also make a special note about people who are status post solid organ transplant, especially people who are 10 years out. They have a very high risk as well. And all of this is driven on data around anal cancer incidence, right? Because anal cancer is still a rare cancer for the general population, but it is a very common cancer in these specific populations. And the other guideline that people should just be aware of is the International Anal Neoplasia Society guideline. So IANS is the group that has been driving the research and the treatment for a long time. I think since like the mid to late 90s, starting at UCSF. But IANS is now an international body. And they had the most broad recommendation. So they base it entirely off of incidence, which makes sense. So 17 per 100,000 is their cutoff. And that includes, with some evidence, HIV negative MSM over the age of 45. Because, yeah, especially if you look at over the age of 60, it goes past that threshold, which I think is a good idea. Yeah, because, obviously those other bodies are focused specifically on HIV positive populations. But I think, if you're looking at a broader lens, it makes sense to include all people who are at risk and really using that risk as a driver for who to recommend this for.